Hello, Matter Nation. Welcome. Today we have a special treat for you. A good friend of mine, Dr. Mike Jeans, is here in the United States with us today, straight from Zimbabwe. He's not only a good friend of mine, but he's also the first time that we've had a doctor on our staff at Matter. And so Mike is helping us in Zimbabwe with the projects that we're working on. As many of you know, we have a lot of depth of impact that we're going for in Zimbabwe right now, and so we are so grateful to have Dr. Mike on the team. And he is here with us in the United States to help raise awareness about what's going on, to be here for our wonderful Rock the Lake event that's happening this weekend. And we wanted to just take the chance to have him share a little bit about some of the things that are going on around Zimbabwe. So, Dr. Mike, welcome to the United States. How has the time been so far arriving?
Well, thank you for having me, firstly, Q. It's been an eye-opener. It's been an experience. Everyone's been so welcoming and so friendly. It's been a wonderful introduction to the United States and the projects and the mothership of Matter, so to speak, on this side of the big pond.
Great. Well, it's great to have you here. Just to kind of jump right in, we do have this November a group of donors that are coming. Jeannie Buckner is kind of leading the charge on this, and she was the one to kind of help us author a project in Binga, a place where you and I have been to see the work that's happening there. Could you just help us understand that community, Binga, and the impact that this project has the potential to have there?
So Binga is one of the wildest, most inhospitable parts of Zimbabwe, and primarily because it's right up in the northern part of the country where there isn't a lot of infrastructure, especially in the rural areas, so some of those populations don't have the access to healthcare that possibly they should have. So that's where I think this project is just going to be incredibly impactful, in the sense that, especially when it comes to maternal and child healthcare, that's a desperate need up there. So at the moment, pregnant women, there are a few clinics dotted here and there, but at the moment it's hours and hours of walking to get to the nearest available healthcare. And as we know, in pregnancy, you need good access to healthcare to avoid complications and problems. So this clinic is going to have a very big impact on that community, I think, in terms of improving access to good maternal healthcare and childcare.
Fantastic, great. Well, thanks for updating on that and sharing that. And the other project that we've been working on is one that was really kind of, you brought it up to us as a need in Victoria Falls at the hospital there. We have on October the 3rd a fundraiser that's happening here in the United States to raise money for what we're calling the LEEP project. That doesn't mean a lot maybe to most of us, but help us understand this idea of the LEEP project and why it's so important to the Vic Falls Hospital.
So the LEEP project is primarily aimed at improving our cervical cancer outcomes, especially in Wangi district and around Victoria Falls town specifically. At the moment, cervical cancer is one of the most common cancers in our population of women in Zimbabwe as a country, certainly in our district. And we're encountering a really difficult challenge at the moment, where we're able to pick up these lesions at an early stage, but we're not able to give them the procedure to remove that high-risk lesion in time. And we have to refer them to a facility which is about 5 hours drive in Bulawayo. And often a lot of these ladies either don't have access to the transport to get there, or they can't afford to get there. And what we're seeing is that these lesions progress, and it's tragic. It really is, and it's entirely preventable if we can do a procedure to remove those high risk lesions. And it's usually an outpatient procedure. It's a very easy procedure to be done. We've got the necessary staff and skills to do there. We just don't have the equipment. And if we did, we would be able to have a huge influence on the outcomes of these women. So a LEEP procedure is something that is usually done by a gynecologist, which we have in Victoria Falls now. It's a very simple procedure, very easy procedure, and it has a high impact on outcomes. So if we can have that in place, it'll be a game changer for our cervical cancer patients in Victoria Falls, and it'll save a lot of lives. Yeah.
Wow. Well, fantastic. Thanks for helping us understand how that works. And I think we're really grateful to have you on the team, Dr. Mike, and this LEEP project is a really good example of something that we would not have been able to identify sitting here in Minnesota, but you brought it to our attention, and we can then help to fulfill the need on this side. So I think it just is representative of why your role is so important on our team, to help us just identify the things that we need to be working on, the highest impact opportunities. And so October 3rd, we're going to have our event to raise the funds for that and get that project completed so we can continue doing good work together. So grateful to have you here, grateful to have you on the team, and we're looking forward to doing some good things together in the future. So thanks, Dr. Mike.
Thank you for having me, Q. I'm glad I can help.